Good afternoon. We are thrilled to be here. Thank you, Governor. Thank you, President, and the team at URI for hosting us today. We are thrilled. We want to really congratulate the entire Rhody family for everything you're doing to keep students, staff, faculty, and the community safe. You're setting an example for organizations, for businesses, for all communities throughout the entire state of Rhode Island to follow. I spoke with the Institute of Higher Ed presidents earlier today. I'm sure we'll be hearing more from them. They've continued to be at the lead along with URI about following these steps. It all falls in line with the role employers have to play here. We talked about it last week, and since then, the Rhode Island Department of Health and Rhode Island Commerce, along with the Department of Business Regulations, sent information and resources to employers throughout the state on these 4 key areas. What we're highlighting today: strong vaccination policies for your employees, accessing our testing programs throughout the state, implementing indoor masking policies as an important way to help stop the spread of the Delta strain, and ventilation. Those are the top areas. We know they can work. The data picture is telling us that we are going in the right direction. We're one of the few states that have started to see plateauing over the last few days and weeks. Those initially sharper inclines in cases and hospitalizations that we were seeing have slowly started to level off. And you know what that message is for all of us? Keep going. We have the tools. We've been talking about the tools. We shared it with employers, and employers such as URI and so many others are taking it and running with it, because then you can say, this is a place that's safe, that this is a place where we know we are doing everything possible. The fact that we were able to slow the exponential increases in cases we were seeing has a lot to do with activating these steps taken by employers, taken by communities, taken by the people of Rhode Island. That means wearing your masks in public indoor settings. That means getting tested regularly, and absolutely getting tested if you have new symptoms, whether or not you're vaccinated. That means taking advantage of treatment along with testing. If you test positive, call your healthcare provider or an urgent care center to be able to access that. And finally, of course, it means if you haven't gotten vaccinated, it makes a difference. Please get vaccinated today. These are the steps that work. Now is not the time to let up. We can not only keep this plateau where other places are seeing inclines, but with these mitigation measures that are strong and work, we know we can start to bend the curve downward. And it's particularly important now as kids start going back to school. So working together, implementing these tools, everyone can do their part. The last thing I'll say is healthcare workers. We know our vaccination requirement for healthcare workers is a place where we are all aligned in ensuring that people receiving direct patient care are going to receive it from people who are protected and vaccinated. All people engaged in direct patient care are required to be fully vaccinated by October 1st. We're not alone in doing this. We know this is an effective approach. The hospitals in our state have led the way in doing it, even in advance of the state, and the state's planning on sending out the message today to the employees about the implementation of working this forward. More than a dozen states throughout the country are requiring vaccination for healthcare workers, and in Massachusetts, staff in nursing homes, assisted living facilities, and home care workers will be required to get vaccinated. It's everywhere. It's what works. These entities are taking this step so that we all together can keep patients and residents safe. Different groups have raised concerns about staffing levels. We hear them. We're talking with them. We're working with them. We want to keep the dates and help people do what they need to close the gap, make sure patients are cared for safely by people who are vaccinated, and get us over the finish line. We can exercise discretion, we can exercise reasonable flexibility, but ultimately, we need people to be vaccinated. All of our healthcare workers have been the heroes of this pandemic. EMTs, other frontline healthcare workers, they deserve our deepest thanks. They deserve our support. They have done so much for their patients. That's what healthcare providers do. They devote their lives and careers to helping others stay healthy and safe. That's why we've received such overwhelming support for this requirement, because it allows us to make the stance clear. We want to make sure that our patients that are most vulnerable are going to be cared for by those healthcare workers that care for them and want to make sure that they stay safe. This vaccination requirement among healthcare workers is one example of many about keeping people who are more vulnerable as healthy as they can, and frankly, about keeping them alive. That's been our critical piece getting through this pandemic, and we're going to continue going in that path together successfully.